So it's my pleasure to introduce the brand new President and CEO of the United Way, John DiPaolo, and as well, Gilles Charette, who was the Executive Director of HIV, Trellis HIV Community Care. Thank you both for coming in today. So start with you, John. Well, congratulations.
Oh, thank you.
You've got a big pair of shoes to fill.
Yeah, I've been telling people I've been buying some inserts for my shoes. Anyways, no, Pavna left a big void in our community, but she's still around. She's still very active and very connected to the community. So we're blessed to have Pavna still around. Yeah,
that's terrific. And so 1st of September, and they throw you in just in time for the major fundraiser of the year, the campaign. How is that going?
It's going well, and actually the nice part about it is that a lot of the planning and preparation, as you can imagine, happens well before September 1st. So we were well set up to hopefully succeed, and I always give the analogy, it's like pushing a snowball up a hill, and then we're just, come September 1st, we're just chasing that snowball down the hill, and hopefully we'll catch it. But no, it's trending well. I think as of today's date, we were at 63% of the campaign, and tracking well and progressing well, similar to previous years. So we're very hopeful, and we'd love to be able to smash the goal that we set. And as we were saying before, it's any amount that we can raise above that would be great for the community.
You usually do beat the goal. I seem to remember each year when we talk about it, you do better than the goal.
Yeah, no, we've got a very thoughtful campaign cabinet that puts a lot of thought and energy into, so this is a group of 25, 30 community volunteers that come together and help the community set the goal. And they make sure that it's a realistic goal, but also an ambitious goal too. So yeah, we have had a very fortunate streak of surpassing our goal, which not every United Way community has, but we've been fortunate in that regard. So thanks to the thoughtfulness of the cabinet and all the hard work, we're certainly trending that way.
What is the goal this year?
So it's $3,820,000.
And you got 63% of it so far.
63%, yeah.
That's a lot of money.
Yeah, just over a couple $1 million, yeah.
But it's not always enough, right, Gilles?
Yeah, the needs continue to increase in our community. The impacts of inflation, the residual impacts of the early days of COVID-19, rising costs of rent, unaffordability of housing. So yeah, there's lots of reasons why the generosity of the community is so important, and why giving to the United Way helps support agencies like Trellis HIV and Community Care to do its work.
So tell me about your agency.
Well, Trellis HIV and Community Care has been active in Kingston since 1988. Its mandate is primarily to provide support, education, harm reduction work in the community. We work with the community's most marginalized and often most stigmatized community, either because of sexual orientation, substance use history, being unhoused. And so while the core of our work is around preventing HIV infection through a number of different means, the time that we're in right now is an acute drug poisoning crisis, and we're seeing communities across Ontario and North America really being impacted by this. And so we are the co-founders and one of the operators of the Integrated Care Hub, which is a low barrier facility for people who are unhoused and use substances and often face barriers in their lives accessing different types of services. And so the United Way has been an essential partner since we opened our doors in August of 2020 to ensure that the people we serve are fed, that we are able to provide crucial supports to keep people safe and well and alive. The staff at the Integrated Care Hub have attended to and reversed over 2,000 drug poisonings since August of 2020, which really speaks to the magnitude of the crisis that we're in. And so the work is essential. The team who are there are really doing heroic work, and that's only possible through the generosity of our funders. And so when people are giving to the United Way, they're ensuring that people are fed and provided with shelter and a sense of community, meaning and purpose. That's really what we're there to do.
So this is something that you fund, but along with a lot of other agencies that handle a similar client base. Mm-hmm. What are the biggest challenges that you think you're going to be facing? Things are changing, and just as you said, housing costs, food costs, it's hard out there.
I think our vulnerable population is growing, and to all the points that Gilles made is that we're seeing more and more people that are living so precariously close to that line where before they were getting by, 6 weeks from now they might not be getting by, and it's literally, we're talking weeks and days where people are looking into the future as to where they can buy their groceries. That everybody's feeling the pinch with the increased cost of groceries, but can you imagine having to decide between paying for your healthy groceries for your family or your kids, or paying your rent or paying your hydro bill? It's something that's not fair, and it's not something that anybody should have to make that choice. But I think we're going to see more of these people that are having to make those really, really difficult decisions. So that's the really biggest problem. And again, like I said, we could double our campaign total and it still wouldn't be enough. There's so much that's needed within the community to support our most vulnerable community members.
You mentioned a drug overdose, but you're HIV. I'm trying to get the connection. Right.
That's a really good question. It's actually a common one, and we've actually been involved in drug poisoning work really since its beginning. But the intent was around providing access to syringes, for example, in order to prevent HIV infection. As the drug poisoning crisis grew in acuity, then the work became as much about preventing HIV infection and HIV/AIDS related deaths as it did overdose and drug poisoning deaths. And so the work itself is the same. It's introducing people to harm reduction strategies, showing them how to use a Narcan kit to reverse an opioid overdose. So it started around preventing HIV infection, and now because of this crisis, it's really about both. So the work has expanded, but its roots are in, so when we think about modern understanding of harm reduction, its roots are in HIV prevention.
Okay, so we're kind of putting it together there.
Yeah.
So 35 years, I'm just doing
Yes.
the math in my head here.
Yeah, it's hard to imagine, particularly when I think about somebody in my generation. The early days of HIV/AIDS still feel very present. The impacts of all the losses and the grief, and we find ourselves in a crisis now that has a lot of parallels to the early days of HIV, where we've got marginalized communities who are most impacted by HIV infection, but also by the drug poisoning crisis. One of the ways that the United Way supports the work is in some of our community outreach and education work, because we know that, for example, racialized, in particular Black communities and Indigenous communities, are disproportionately impacted not only by HIV/AIDS but by the drug poisoning crisis. And so it's important that we find ways to reach people in a culturally competent way that demonstrates safety, and we're pleased to see that as a result of the work that we're doing and the investment the United Way has made, that we're seeing more newcomers entering our space to access food support programs, for example, but it also creates a bridge and a relationship so that if they ever need HIV support services or harm reduction services, they already have a relationship with us. So it's a really important work as far as being able to reach equity-seeking communities who are often the ones who bear the brunt of some of these crises that we see.
You must find that, John, too, with some of the other agencies, the ones that provide food, Martha's Table, Lunch by George, a few others that I know that you have a hand in. They've got to buy the food as well.
Yeah.
And the food prices are going up for them as well,
Yeah.
and the need is increasing.
Yeah,
Can you talk about some of the increases just in people who need these kinds of supports, who never thought they would ever go to a food bank? And I've heard stories of people saying they used to donate to the food bank, now they're going to the food bank. I've heard a few of those stories. So how are you finding with these other agencies? Are they up against the same thing? How are they coping?
Yeah, you're exactly right, and we're seeing it on both sides, where there's an increased demand for the services of these food providers, but on the flip side, these food providers are also having to pay more and more and more money for the food that they're having to buy and serve. Thankfully, throughout the pandemic, there was some good things did come out of the pandemic, believe it or not. One of them was the Community Food Redistribution Warehouse, which is a partnership of several different organizations, and it's managed by Lionhearts here in town. But we're able now to start accepting these larger scale donations of food, which, in years past, pre-2020, these would go right on by us in the 401, and they'd go to the next community if they're donating 50,000 pounds of potatoes or something like that. We could never receive those donations. Thankfully, with the community food redistribution warehouse, we can accept those now. So that again can hopefully curb some of the costs of the food for these food programs and bring those down a little bit and make it more manageable for them. But you're exactly right. We're seeing it's a pinch on both sides where there's more people that are needing the services and the costs are going up and up and up as well.
So you've got those kinds of challenges. You're in the middle of a fundraiser, but from the 1st of September, what were your goals for the United Way? I know they've done extremely well on before, but where do you want to see? Where's your direction on this?
Sure. So our certainly our goals in the fall are fundraising related. So for us, it's achieving our fundraising goal and hopefully exceeding it as well. But especially with anytime there's a change in leadership of an organization, it's the stability that we wanted to provide the community as well. And I know our board was very thoughtful in that process and wanted that stability to be there. So, you know, I had 13 years experience working with the United Way. I got to experience a lot of different things with the United Way and certainly have the great leadership from Pavna and learned from her over the past 13 years. So that was really the goals for us. And I think we're achieving those to date. You can check back in with me at the end of November and I'll let you know.
And I think we have plans already to have you back to talk about and we'll break out the champagne.
Appreciate it. That sounds great to me.
Absolutely. So we're talking about drug overdoses, the integrated care hub. A lot of controversy that goes along with it. Mm-hmm. So what was the point of and why is it working so well? Because I think most people, they hear the negative side of it. What do you say to that?
There's a couple of things on a really fundamental level that I think work well with the Integrated Care Hub, and one is that we prioritize providing employment to people with lived experience of being unhoused or having substance use challenges, and that commonality with the people we serve helps to engender trust. And so we've really created a sense of community where people feel like they can belong, have a sense of meaning. We have vocational training programs that we offer that are attractive to people and provide pathways out of homelessness. And one of the things that I think makes the Integrated Care Hub unique is the collaboration between the various partners who come to the table to deliver the work. And that's something that's really in common with the United Way, in that there's really a number of agencies that are funded by the United Way, and the United Way has an important role in connecting those agencies to one another. We were just talking about food redistribution. Lionhearts provides a number of the meals for the people that we serve. That again is in connection with the United Way, who is the funder for that portion of the work that we do, and also helps to connect various agencies together who may be able to support one another if they specialize in different areas in order to tackle some of our community's biggest challenges. So it's one of the silver linings of COVID for me was that organizations who may have worked in their own silos are collaborating in a way that I haven't seen before, because I think we recognize that if we work together, that we'll just be more effective in the work.
My understanding you said 2,000 reversals of drug overdoses. And the way I've thought about it is at least they're right there with the facilities available to them and the people who need to do this available to them. Otherwise, they're all over the city. And every time there's an ambulance, a fire department, police probably involved in every time. Imagine yes. 2,000 times that would have happened in the city without the hub being there so that at least it's contained. Is that
absolutely,
fair?
Absolutely fair. I think people go to where the services are, and so there is something to be said about having a facility like the Integrated Care Hub present to deliver those services. But think also about the number of people who have been diverted from the emergency room. So we know that there's a challenge in emergency rooms around wait times, and it's a chronic challenge. From an efficiency standpoint, being able to respond to a drug poisoning at the Integrated Care Hub or at other places that have safe consumption sites is a much better use of healthcare dollars than having someone present at the emergency room, which then has a domino effect on other people who are waiting to receive care as well. So it's got some real practical benefits that those of us who don't struggle with substance use challenges don't necessarily appreciate, and that without a facility like the Integrated Care Hub, we would have had over the last 3 years 2,000 people presenting to the emergency room if they actually survive long enough to make it there. And so this is a life-saving service, but also a service that provides relief to other systems in our community. So it's really important.
It is important, and it's kind of a doom and gloom kind of sense that we've talked about, but what are some of the successes that you've seen? You've reversed 2,000 drug overdoses. That's great. What else?
When that question's asking me, I think of one person in particular who's been somebody that we've served for over 20 years. This person initially connected with us because he's HIV positive and had been incarcerated, and upon release connected with the agency and received a number of different supports. He's had peaks and valleys over his lifetimes where he's been involved with the justice system, and other times where he's done really well. During COVID, he was released from incarceration and ended up at the Integrated Care Hub. Because he knew some of the staff from before, because he's got a long relationship with the agency, he was able to cultivate trust, and we were able to work with him around connecting him to housing. We have, as I mentioned earlier, a vocational training program, so we were able to provide him with some work. And as a result of that, he's making a living wage doing work. He's in a transitional housing unit now, and he reconnected with his mother, who he'd been estranged from for over 10 years. Wow. And so that story is just one example, and it's of course a very happy ending for that individual. Well, his journey continues, but we hear stories like that all the time, and so stories of people being housed, people being connected to employment, but also some of our successes come from somebody who struggled to actually make it to a doctor's appointment, actually making it to their appointment. So some of those incremental things where the historical barriers that people have faced, and they may have resistance accessing services because of the way that they've been treated and stigmatized, because of the work that we've been doing in helping to bolster confidence, we've been able to see some of those smaller victories.
Yeah.
Go ahead.
No, I was just going to say, I think we need to shift, or we all need to sort of shift our thinking around what a community is, because what they're doing there is creating a community for these people, right? And it's a true community. Right. We all have our neighborhoods we live in, and neighbors we rely on, and that we trust, but that's what they've created there. And they're, like, I know Gilles mentioned 2,000 lives that they've saved. That's real impact.
Those are real people.
Yeah, they're real heroes, yeah.
And all good reasons to support the United Way, especially this time of year. Thank you so much for coming in today. It's so nice to see both of you.
Appreciate it.
Be here.
Thank you.
Thank you.